Good afternoon, my name is Thomas Walsh and my how-to video is on patient assessment for EMTs, more specifically trauma assessment. When EMT receives a call from dispatch and they get to the scene, they need to do what they call as a scene size up. So they need to be asking themselves, is the scene safe? Has it been released by the police there? And on top of that, they're going to need to also check to see what kind of PP or BSI they're going to need. Now that's basically, they need to put gloves, a mask, booties? Are they going to need to upgrade to a different uniform to be able to protect themselves from bloodborne pathogens? What is also the mechanism of injury or the nature of illness? So was it a motor vehicle accident, or did the patient have a stroke and they're lying there? How many patients are there? Those are questions that you need to ask yourself and be aware of. If there's multiple patients, are you and your partner capable of taking care of those patients, or are you going to need to upgrade care and request more assistance? Once that's been established, then you need to go ahead and do something, what they call the rapid assessment. This is going to be your first primary survey, so you need to be checking the level of consciousness of the patient, asking them questions. What's their name? Do they know where they're at right now? What day is it? These seems like very simple questions, but these are questions that are checking their alertness. And the medical field is very notorious for having acronyms, and one of the ones for this is called AFPU, and this is checking are they alert, verbal response, or do they react to a pain response, or are they just unresponsive altogether? Once you basically establish their responsiveness, you need to go ahead and do the ABCs. Now that's checking their airway. Do they have a patent airway? Are they able to breathe properly? Checking their breathing. So is their chest an equal rise and fall in their chest? Is their breathing? Is it shallow breaths, labored? Is it rapid breathing? When you're checking their circulation, then you need to go ahead and check their pulse. You also need to be checking to see if their skin is the right color. Is it clammy? Are they flushed? And at this point, you should be actually transporting or getting ready to transport the patient. And then once that occurs, then you need to go ahead and be able to obtain the patient history. So another acronym is SAMPLE. So you need to be getting the signs and symptoms, the allergy, the medication that the patients have taken, their past medical history. Have they had high blood pressure in the past, their last oral intake, and what was the event that occurred that caused this issue? Once you've obtained that, then and you're in transport, then you need to do a secondary assessment. Now this is a much more thorough assessment, so you're going to be checking their head, neck, it's a head to toe, so their head, neck, chest, the abdomen, upper and lower extremities, and their back. So you'll be checking what another acronym for it is DCAP BTLS. Now you're going to be checking for deformities, contusions, abrasions, penetrations, burns, tenderness, lacerations, and swelling. You need to be actually hands-on on this. You need to be able to feel each body part so you are covered and you're able to assist the patient as needed. And you also need to check their vital signs. You need to get a good BP there, check their respirations, see if they're, check their eyes. So if their pupils have an equal reaction to light. And then once that's been done, then you can actually, ideally everything is kind of somewhat settled and you can downgrade so you're not in such a rush. But if they are a critical patient, then you need to make sure that you recheck their vitals every 5 minutes. Now, if it's not a critical patient, every 15 is about standard. But you also need to remember to document all of this. That way, once you get to the hospital and you transfer the patient to the care of a physician, a PA, a nurse, or a doctor, they're able to look at the documentation and be like, okay, this is what's done. And they can go from there rather than going back and rechecking all of this and wasting more time. This was a very abbreviated patient assessment, but when you're in the field, you definitely need to be able to do this quickly. I hope you learned something, and you'll have a great day. Thank you.